It's nice fall weather. It's 64 degrees in Boonville, Missouri. And y'all in Oklahoma that watch me, get ready because they're predicting wind chills in the 30s. So time to get your fall clothes out. It already feels like fall here in central Missouri. I'm sitting here having my little cup of coffee, and I'm sitting here drinking my elderberry juice that's homemade from a friend of mine here in Boonville. Comes in a little half pint mason jar. I'm trying to get her to make pints. We'll see. So, elderberry, zinc, quercetin. We've talked about all this vitamin D, and part of this study that I'm going to do or review for you talks about vitamin D. Good morning, Eileen. Okay, so continuing on my nerdness, I read this study. A friend of mine from Boonville put it up yesterday, and I thought, okay, that's a good topic for class this morning. So I read the study, and it would be very difficult for me to explain the study without tripping over my Missouri tongue. Morning, Wendy. But I did find a post or an article on Medium that actually does a pretty good job of dissecting down all the weird words in this journal article. Came out in July. And it's basically a sort of it is a new hypothesis on the coronavirus. Yep, that's right, Wendy. A few more things that we talked about. I put that list up a month or so ago, or I guess it was right before we started school, about how to protect yourself, teachers and staff and students. So I told all my students at State Fair, here's what you should take if you're, since we're on campus. Good morning, Linda. I'll call you later today. Okay, so here's the deal. This is on Medium, and if you don't subscribe to Medium, I'm not sure you can get to it. I write for Medium, so I get to look at stuff, but only a short, just like 5 articles a month, unless I pay them $5 a month. You can do that and read whatever you want. So this is called A Supercomputer Analyzed COVID-19, and an interesting new theory has emerged. It's from Thomas Smith. He wrote this 3 days ago. Lives in San Francisco Bay Area. So it's the Bradykinin hypothesis. So earlier this summer, at Oak Ridge National Lab in Tennessee, they used a supercomputer. It's called a Summit supercomputer, and looked at the data on about 40,000 genes from 17,000 genetic samples. And the point was to try to figure out and better understand what COVID-19 does to people, to make the really ill ones. So we're at, I think, 181,000 deaths in the United States from COVID-19. I can't remember all the numbers for the world. 2 million, I think, deaths, something like that. Anyway, so this Summit computer, it's the second fastest computer in the world. And so it analyzed 2.5 billion genetic combinations, and even with a fast computer, it still took a little over a week to crunch all these numbers. And so when it was done, they analyzed the results. And the lead researcher was Dr. Daniel Jacobson. And he said when they analyzed this, he got what he called a eureka moment. So it's a new theory about how COVID-19 attacks you. It's called the Bradykinin hypothesis. And I'll explain Bradykinin here in a minute. So it's a model that explains a lot of aspects and some of the bizarre symptoms that occur with COVID-19, and also has a suggestion of about 10 potential treatments, many of which are already FDA approved, so they're on the market. So we're not going to talk about that. I'm not going to name antibiotic for malaria that everybody's talking about. These are different ones. They're still, but they're FDA approved, so they're on the market just like that other one is. Okay, so early July is when this paper was published in a journal called eLife, And according to this team, this infection, we talked about this in March, I believe, enters the body through the ACE2 receptors in the nose. So ACE stands, sorry, I've got my, see, I get a, first I have allergies, and the second I take an ACE inhibitor, and one of the symptoms of, or side effects of ACE inhibitors is a dry cough. It's one of the reasons I quit taking lisinopril, because I coughed all the time. But this is irbesartan. It's an ACE inhibitor. So ACE stands for angiotensin converting enzyme. The inhibitor I take blocks ACE1 receptors, and angiotensin is the strongest vasoconstriction molecule in your body. ACE2 tends to vasodilate, so the virus gets in through the ACE2 inhibitor, and when that is turned on, you vasodilate, and this theory of bradykinin is different than the cytokine storm that we talked about last spring. So we're 9 months into this pandemic. We still have no great leadership from CDC, WHO, FDA, as to what doctors are supposed to do if you have symptomatic COVID-19. The recommended treatment is Tylenol. That's it. That's the only recommendation from the health leaders of this country. Oh, give them Tylenol. Send them home. See what happens. And then you're supposed to come to the hospital if you get respiratory distress. So the virus attacks you and gets in your body through the ACE2 inhibitor, and then it starts. Let me take a drink. Then it starts changing the ACE2 receptor throughout your body. So it kind of turns it on. So it enters cells where ACE2 receptors are already present, like the intestines, the kidneys, and heart. And so that at least accounts for some of the disease's cardiac and GI symptoms, right? But once it's established in your body, the virus starts getting more virulent, and it gets interesting. So it's not content just to infect your cells that already express those receptors. Instead, it hijacks your body's own system and tricks your body into upregulating ACE2 receptors in places where they're usually at low or medium levels, so including the lungs. So in this sense, and this is a direct quote, this is interesting, COVID-19 is like a burglar who slips in your unlocked second floor window and starts to ransack your house. And then once inside, they don't just take your stuff, they also throw open all your doors and windows so that their accomplices can rush in and help pillage more efficiently. That's a succinct statement about what coronavirus does to your body, COVID-19 specific virus. Okay, so then they go on to talk about the renin-angiotensin system, which comes from the kidney, and it controls a lot of your circulatory system, and it controls your blood pressure. So when I teach my physiology students about the kidney, I blow their minds, because the kidneys do more than just make urine. There's all kinds of stuff going on in kidneys. And so, they start that chapter thinking, okay, we're going to learn about making urine and all that, and they do that. But the kidneys are very important to your blood pressure management, control of your circulatory system through this system, the renin-angiotensin system. Okay? So according to the analysis of this team, the virus tweaks the renin-angiotensin system and changes the body's level of a chemical called bradykinin. Okay, so the bradykinin system goes haywire. So the receptors for bradykinin are resensitized, and the body effectively stops breaking down bradykinin. So ACE normally degrades bradykinin, but when the virus downregulates the receptor once it's in, it can't do that effectively. So the end result they call a bradykinin storm. So we talk about cytokine storm, that's the immune system. This is the bradykinin storm, which has to do with your circulatory system, helps regulate blood pressure. So it's a runaway massive buildup of bradykinin in the body, and according to this hypothesis, it's this storm that's basically responsible for many of the deadly effects of COVID-19. So, a quote from the team: the pathology of COVID-19 is likely the result of bradykinin storms rather than cytokine storms, but they may be intricately linked. Okay, so the cytokine storm is we talked about, the immune system storm. This is a vascular system storm. So they're basically saying, and we several of us that do these updates talked about the vascular impact of COVID-19, I think in March or April, when that started coming out. So as bradykinin builds up in your body, it increases the vascular permeability of your vessels dramatically. That's a dangling participle, sorry. But it basically makes your blood vessels leaky. Okay, so you fill up with fluid. So that aligns with recent clinical data, which increasingly views COVID-19 as basically a vascular disease rather than a respiratory one. But it does have huge effects on the lungs, obviously. And so as blood vessels start to leak because of the bradykinin storm, the lungs fill up with fluid, immune cells leak out into the lungs, and that causes inflammation. Okay? Then it has another little trick that it pulls on you. Through another pathway, it increases production of hyaluronic acid in the lungs. Now that's part of your body anyway. Hyaluronic acid is used in soaps and lotions because it can absorb 1,000 times its weight in fluid. It's also used for injectable cosmetics in the form of Juvederm. You've heard of that. So if you combine fluid leaking into the lungs with inflammatory cytokines from the immune system, you get hyaluronic acid that forms a gel and can fill the lungs of patients. So they call that in this team, it's like trying to breathe through jello. And that's if you've ever seen a syringe full of Juvederm, which is safe. I mean, hyaluronic acid is, you're not allergic to it, it's part of your body. So they use hyaluronic acid because of its properties. But in this state, it's turning into a gel like Juvederm. It'd be like drinking Juvederm. Well, it'd be like inhaling Juvederm into your lungs. It would gel up, and you would have trouble breathing. So there's the reason that ventilators have not been effective, and the doctors, one of whom was censored and his video taken down, talking about the fact that this doesn't seem like it's the typical adult respiratory distress syndrome, where people have had hypoxic states, low percent O2 saturation, that they were still talking. Most ARDS patients can't talk. They're gasping for breath. So these people are gasping for breath, but they can still talk. And then ventilators, he was afraid that ventilators were actually harming people. And there are long-term effects that we're seeing. So you can get COVID-19 and not wind up on a ventilator. So there's plenty of people that get symptomatic that aren't sick. I know 3 personally. But there can be some long-term consequences for your brain and for your heart and for your kidneys, all those nice things that keep you alive and healthy. So it reaches a point where regardless of how much oxygen you pump in, it doesn't matter, because the alveoli, the little sacs that you breathe into that transport oxygen back and forth, CO2 out of pulmonary vessels and O2 into the pulmonary vessels, because the alveoli are filled up full of hyaluronic gel. So the lungs are like a water balloon. Okay? So you can suffocate if you have hydrogel in your lungs. You can suffocate no matter how much oxygen and breathing support that you get. Okay, so this hypothesis also seems to extend to the effects on the heart. So about 1 in 5 people that are in the hospital for COVID-19 have have damage to their hearts, so myocardial infarction, congestive heart failure, etc., despite no history of previous heart disease or cardiac issues before. They can get arrhythmias, heart attacks, um, congestive heart failure. Those people, a lot of times those people's lungs fill up with fluid called pulmonary edema, and so if you're filling more fluid on top of a hydrogel, that's even worse, right? So the renin-angiotensin system also controls cardiac contractions and blood pressure. That's what it does. Okay. So bradykinin storms can cause arrhythmias and lower blood pressure, which are often seen in hospitalized COVID-19 patients. Okay. Also, this hypothesis of bradykinin storm seems to account for some of the neurologic effects, which are kind of surprising to doctors. They're concerning because basically these people get symptoms like dizziness and seizures. They can get delirium, they can have strokes, and that's been shown in as many as half of the hospitalized COVID-19 patients. Okay, so what they're seeing is that patients have evidence of leaky blood vessels in their brains. Okay, you can also, with too much bradykinin, break down your blood-brain barrier. So we talk about what crosses in my physiology class, what crosses the blood-brain barrier, how that's used in pharmacokinetics and pharmacology and pharmaceuticals. But the barrier acts as a filter between your brain and the rest of your circulatory system. So it keeps stuff out of your brain that shouldn't be in there. Some things do cross it and they're helpful. Some things cross it and they're not helpful. And this one, if you get a breakdown of your blood-brain barrier, then you get viral infiltration of your brain. Okay, so you want to keep out toxins and pathogens because your brain is tightly regulated. It's an internal environment that is separate and distinct for the most part from your circulatory system. Okay, you do have blood vessels and arteries and dural sinuses in your brain, but there is that blood-brain barrier protecting you. So if the blood-brain barrier is breaking down, then harmful cells and compounds get into the brain, you get inflammation, potential brain damage, and those neurologic symptoms that, that I was talking about 2 minutes ago. So it's a reasonable hypothesis that bradykinin excess is leading to some of those neurologic symptoms in COVID-19 patients. Okay, so if you increase the permeability or leakiness of the blood-brain barrier, that's a problem. Could also account for other symptoms. So ACE inhibitors, the irbesartan, and losartan's another one. So I take irbesartan. They're used for high blood pressure. So ACE inhibitors can also have an effect on the renin-angiotensin system, similar to COVID-19. So that little dry cough that you hear me do all the time that's probably annoying, one of the symptoms of early COVID start of symptoms is a dry cough. It's not a productive cough. That comes later, but a dry cough. So I've gone back to teaching on campus. I've been in the high school. I haven't taught at the high school yet, but I'm in front of a bunch of students, one of which was quarantined from my that was in my class, so he didn't get to join us until he quarantined for 2 weeks. And then the University of Missouri, I think, has 357 cases on campus. So, fortunately for me, I can explain my dry cough, so I've got to watch out for headache, fever, and loss of my sense of smell and taste, none of which I've got. So that little cough that you hear all the time is probably my irbesartan. Okay, so ACE inhibitors like irbesartan and losartan do increase bradykinin levels, but the virus acts as an ACE inhibitor, almost mirroring the actions of those drugs. So like I said, I have to pay attention to other symptoms than dry cough because I've had a dry cough for 1.5 years taking irbesartan, and previously on lisinopril, which was way worse. I would be coughing every like 3 words if I was on lisinopril. Okay, so by acting as a natural ACE inhibitor, COVID-19 may be causing the same effects that hypertensive patients get when they take blood pressure lowering drugs. So dry cough and fatigue, 2 textbook examples of the start of symptoms of COVID-19. Can also increase your blood potassium level. So my doctor in Columbia, he's a hypertension and nephrologist, kidney specialist. He wants my potassium level every time I see him every 6 months. So I get that down about every 6 months about. And so we make sure that my potassium level is okay. I also take spironolactone, which is potassium sparing, which can also increase potassium level. So, and potassium, if it gets too high, starts messing with your heart rhythm. Very easy to get arrhythmias from a potassium level of over 5 or a potassium level less than 3.5. So people that take diuretics have to watch their potassium levels because you're urinating it out. And if you're on a hydrochlorothiazide or diuretic, Lasix, all that, furosemide, you need to be taking, either you need to be eating a banana every day or you need to be taking potassium chloride as a supplement. So I digress. So this is an emerging theory, but it explains a lot of the bizarre symptoms that doctors haven't seen with previous coronavirus or influenza cases. This is a totally different deal. They even explain, they think it explains COVID toes. So people who get COVID toes have swollen and what look like bruised toes, okay? So that seems to, because of the leaky vasculature, and that's the most weight dependent part of your body, that might explain COVID toes. And then bradykinin can also affect your thyroid gland, and some patients have had thyroid symptoms. Okay, may also, the hypothesis, explain some of the broader demographic patterns of the spread of this disease. So, the renin-angiotensin system, some of those are sex-linked with proteins for several receptors that are located on the X chromosome. So that means that women potentially might have twice the levels of this protein than men. And in this paper, the team concludes that that could explain the lower incidence of COVID-19 induced mortality in women. So there may be that women have an extra protection against the disease. They didn't mention anything about the blood group antigens, so your whatever your blood type is, but O positive, thankfully me, seems to protect you from COVID-19 as well, somewhat. I'm not saying that everybody has O positive blood's not going to get COVID-19, but there is a less attack rate on O positive people. Okay, so this is in addition to all the literature that's been generated since what they think was an infection that started last fall, like maybe September, October, definitely by November, out of Wuhan, China, with some. The history of this is that the World Health Organization was kind of warned, well, it was warned in December. They denied that they knew anything about it, and they just ignored it. They didn't do anything about it. So there's your people in leadership that supposedly are supposed to protect us from this type of epidemic and pandemic. Okay, so several medications target aspects of the renin-angiotensin system, so they brought that up. There are several that are FDA approved, and I'm not going to take my Missouri tongue and trip over all of the names of these. The generic names for medications are always kind of strange and hard to pronounce. But the one that I've used, Danazol, I've used that for endometriosis years ago. Danacrin, that's one of them. Stanazolol, and ecolantide. So I told you I wasn't going to trip over them, and I just did. So I'll quit talking about the names of them, but they're out there. Then vitamin D. So there's about 8. They mentioned about 8 of these medications that are, well, 6 that are FDA approved, 2 they're looking at. And they also suggest that vitamin D may be a useful COVID-19 drug. So I've told you about protecting yourself and improving your immunity with vitamin D and all the things that I put on that list 3 weeks ago. But this vitamin D, so important, and they say 20%, in this paper they say 20% of Americans are insufficient or deficient in vitamin D. It's usually, really, the reported rate is about 50%. And if you check it, you can do a blood test. You can order your own vitamin D blood test and figure out what your vitamin D level is. You want to be over 50, and ideally you would be 65. Most people, even if they're in the normal range, they're in the low 30s. Okay. So vitamin D is involved in the renin-angiotensin system, and it may reduce another compound that I'm not going to trip over, which could stop bradykinin storms from even forming. So vitamin D, in this research paper, they're saying it's therapeutic. I'm telling you it's protective or immune boosting. So if you're eating well, and if you're not eating well, you better. Or if you're overweight and you have poor nutrition, you at least need to take some supplements, multivitamin included, to help boost your immune system in case you get exposed, because you will be. I mean, this thing is rampant all around the world, so you're going to be exposed. So vitamin D, over the counter, easy to get. 5,000 units, international units, that's 125 micrograms. So that would be an potentially easy and relatively safe way to reduce the severity of the virus. That's their hypothesis. Okay. There's some other compounds that I'm not going to trip over. It's hymichromone, and I'm sure I completely destroyed that. That reduces hyaluronic acid levels and potentially could stop the hydrogel from forming in the lungs. Okay. And then there's timbastatin, could mimic the mechanism that researchers believe protects women from more severe COVID-19 infections. So those are all speculative. No randomized, double-blind, placebo-controlled studies have been done. That's how you figure this out. It's, science. And so this has been a difficult disease for physicians and healthcare workers to figure out. It's been hard to do. So the fact that it doesn't make sense means there's a different mechanism of action. This one is a vascular hypothesis, and we talked about leaky blood vessels with inflammation from the immune system and the cytokine storm. This one adds the beauty or the terror and horrifying effects of forming hyaluronic gel inside your alveoli. So if it's just if it was not doing that, then maybe the cytokine storm, which comes along with the bradykinin storm, so you get a double whammy. So it's attacking your lungs and the alveolar sacs, leaking your blood vessels, and then the bradykinin storm is starting all over your body as that virus upregulates and then downregulates the ACE2 receptor. Okay, so that's my COVID-19 update. This is a fascinating little hypothesis. They're not saying it's true, but 1 week of a supercomputer looking at genetic variables is showing a different viewpoint of COVID-19. So I'll see you all Monday morning. It's going to be a nice fall weekend here, so you all have a great weekend. If I can, I'll try to put this paper up I can put the actual research paper up if you care to read it. It's kind of hard to read. Like I said, I'll be the nerd for you and hopefully explain that in reasonably plain English. So peace and health to you all, and I will talk to you next week. See you later. Bye-bye.